every 40 seconds someone in the world commits suicide. This would come close to being 800,000 people dying from suicide alone every year. And this was without counting the number of attempts and the amount of people harming themselves in that process. And worldwide, suicide is accounted for being 1.4% of all deaths committed. And in the coming years, it's only going to increase due to the rise in issues in the world. So, and many health professionals are arguing that suicide is more than just a behavioral, it's a disease caused from like depression or misuse of like drugs and alcohol. So they're trying to make it more widely like so they can find more ways to help people and patients and people who are at risk of suicidal thoughts. So today I'm going to talk about the two top countries with the highest suicide rates. I'm going to talk about society's influences on suicide and as well as prevention for suicide. So first, I'm going to talk about the countries with the highest suicide rates. Trendy from Trendy 2018 said that South Korea is ranked second highest in the world for the highest suicide rate. It's reported that it's 28.1 suicides per 100,000 residents. It affects children ages 10 to 19 years old as well as adults 60 plus years. So the causes are from like a fear of a second economic crash. The first one was in 1997, and they're just in so the suicidal ideation comes from just anxiety of economic problems. And going forward, Lithuania is ranked the first highest country in the world with the highest suicide rates. It is 31 suicides per 100,000 residents. The leading cause is as well as economic issues. They have a history of economic problems within their country. It ranks, the prevalence is males and ages 35 to 54 years of age. This is from at their peak of their production. This is when they have their family stress and as well as work stress. And then World Health Organization 2016-14 surveyed 32 countries, 29 of which were low income and middle income. So, and they surveyed these countries with a 12-month pool to survey the suicidal ideation. And so what the results were that 16.2% among females had suicidal thoughts within that 12-month period, and 12.2% amongst males. And then in the Americas, it was seen that females were actually more likely to have the suicidal thoughts. And the factors associated within these countries are from violence, bullying, drugs and alcohol, loneliness, and parental, like without a parent. Okay. And next, I'm going to talk about the society's influences on suicide. PMC 2012 said that suicide in the media is makes children more vulnerable to it, and this is coming from like celebrity headlines of there's like suicides and attempts as well, and it kind of sparks the youth, meaning that they're role models, so they kind of look at them and they look up to them. But then when this like unfortunate event happens, they feel more like they're closer to it and it affects them more. And then from the Canadian Journal 2018 said that they did a observational study saying to see how bullying affects the youth as well. And in this study that there was it was reported that 6 of the deaths were caused from bullying, and other stress factors were from the conflicts with parents, academic issues, criminal and legal issues, and depression. Next, I'm going to talk about suicide prevention. With this, it's seen that suicide is, there are many warning signs. This comes from talking about harming oneself, looking for outlets to harm oneself, like weapons and drugs, and also if you ever see like a family member or friends, and to proceed with caution, because but also show that you care, and then also giving to recommendations for doctors and psychologists, and then also what is needed within many countries is the prevention training. So this is a necessity for patients and who are at risk. So it's really crucial to have the proper training for it. And also if so what I talked about was the 2 top countries, 2 highest countries. I talked about the society's influences and then suicide prevention. If you want to know more about suicide prevention, you can always go to National Suicide Prevention Lifeline. Thank you.